How can you
What's his
tell
weight?
if your pet is too fat?
Too fat if the rib cage is no longer obvious or not even palpable, and then you no longer see the waistline, sort of waistline that
I haven't seen
that,
his
that
waistline
part
in
here.
years.
I think he's just okay,
Okay.
considering.
The world has gone bonkers. We now live in George Orwell's 1984. War is peace, ignorance is strength, and crazy is normal. How do you stay sane? Dr. Wil Almoro is a veterinarian with 18 years experience. He works with a lot of animal welfare groups, most recently CARA, and his clinic is in Makati. Dr. Wil, thanks very much for taking time. This is my cat Drogon. Wandering around the set, you will see Tea's 2-year-old poodle Pablo. Yeah, can we offer you something to drink?
Water, please.
Okay. Here's our assistant Gamba
Hello.
to give you the water.
Thank you.
Yes, and so why did you decide to become a veterinarian?
Oh, you want the dramatic story?
Yes, yes, please.
Okay.
We like drama.
I grew up in UP Los Baños. My parents are both staff of the university, and we're not very well off. And for my family to take our pet to the vet, it means we saved enough money to bring our pet. One time, we have a beloved puppy, and my sister was able to save some money. So she brought the puppy to the vet, and that experience had an impact on me. So my pet being an Aspin, a native dog, the clinicians didn't spend much attention on our pet because it was an Aspin. This was back in the 80s, okay?
Yes,
This was
yes.
back in the 80s.
I am familiar with that.
That scenario?
attitude, yeah.
Okay. And then along comes in a Shih Tzu, and
And
everyone
suddenly
was...
everyone's plotting all over the shit.
Exactly.
It's actually very Pinoy. It's like kung mistisa,
Right,
papansinin.
right,
Pero kung
right.
if an India like us,
Yes.
so,
That experience had an impact on me, and so I said, maybe I should help out the animals that are really in need, which are mostly the
Yeah.
Aspins and the Puspins. So I took up vet med for college, and after finishing vet med, I specialized in small animal. During my time, there was a specialization program in UP, spending 3 weeks at your preferred hospital. I didn't like the setup of a private practice because maybe of that experience as well. So I gravitated towards animal welfare side of the practice. Started specializing in small animals. So I worked in a shelter that rescues, rehabilitates, and adopt out dogs and cats, mostly Aspins and Puspins, for 10 years. Then after that, I went on my own, put up my own private practice. But I mostly cater to indigent pet owners. Still, those who loves their Aspin, or sometimes they have pure breed dogs and just sadly couldn't afford the exorbitant fees of vet clinics. So that's my clinic right now.
Thank you very much for doing that. This rebranding from Askal and Pusakal, yung Asong Kalye, Pusang Kalye, to Asong Pinoy, Aspin, Pusang Pinoy, Puspin. I kind of like Pusakal because it suggests that, they're fugitives from justice. I guess Drogon is technically a Puspin because
Yes.
I rescued him. He just ran into my house. Here, meet Dr.
Hello.
Wil.
He's
7 years
Is he a
old. He was a
lap cat?
little
No.
over a year old when I found him.
okay.
He's actually quite well behaved, and he allows me to cut his nails, ha?
Oh, good. No
Is he
complaints?
too fat? How can you
What's his
tell if
weight?
your pet is too fat?
Too fat if the rib cage is no longer obvious or not even palpable, and then you no longer see the waistline, sort of waistline that
I haven't seen his
that
waistline
part
in
here.
years.
I think he's just okay,
Okay.
considering his how long his body is and what's his weight.
I don't know.
Around 6 kilograms.
Weighing scales are forbidden in my house for obvious
Okay.
reasons.
Okay. I think he's just right.
Okay.
Just right.
And
Can't
he
be
has a
any more
very strong
heavier.
appetite, because my gauge always for the cats is if they have a strong appetite, they're fine.
They're fine.
The minute they they don't eat, that's when I start to panic.
Yes, yes, that's a good sign. That's a good sign that that you tend to watch out for.
I always read that you're supposed to try to brush your cats and dogs' teeth. This one will kill me if I approach him with toothpaste. So, how do I know if his teeth are okay?
Okay, try is the right word. You can just try, but it's very difficult to do so.
Yeah, but I read somewhere that if they eat kibble, that helps to keep the particles from settling between their teeth or something.
You know, that's more applicable for dogs.
Oh.
I know.
Yeah, because they even have those chewy sticks.
Yes.
Yeah.
One thing I noticed, dental issues, dental problems is more common in cats. I think it's the number 1 or 2 most common problem in cats. Yes. I think it has something to do with how they've evolved. When you look at their teeth, they're mostly sharp.
Yes.
And sharp teeth.
Vampire fangs.
Yes. And therefore tearing.
Yes.
From the wild, from before we domesticated them, their diet is mostly as they've become domesticated, we give them pellets, and mostly for pellets, they have to grind it, chew it, and chewing teeth basically are the premolars, the flat ones. For grinding, we used our flat teeth, but for cats, they have to grind their food, but they don't have the flat surface. They're mostly sharp. That's the reason why it's more common now for cats to have dental problems because of the diet that we're giving them. For Drogo, one thing I noticed is that he has this, we call it haloing. The area, the gums around each tooth are reddish. Okay? And
Is that bad?
Yes. And he has dental deposits already, especially in the premolars.
So I have to take him for, I guess, dental cleaning.
Yes, for dental cleaning. And if you notice, there's one part here, just right behind the root of his canines, that is very red. Sorry, Jojo. This part.
Okay.
That one is very red. So there might be some infection going on at the root of that canine. I think it's on both sides.
So take him for dental cleaning.
Yes.
Well, we actually have a guest in studio who is a 2-year-old poodle. Maybe Gamba can bring us Pablo. Our producer's very friendly poodle.
Hello.
So would you say that he is thin, fat?
Oh. Are you nervous? I think he's 2 years old. The rib cage is not as palpable. So I think he's getting to the obese side.
Oh,
how often
dear.
do you feed him?
Judgment. Is it a good idea to have an all-day buffet for your cats and dogs, or you should really time their...
The advantage of that is there's food the whole day.
Yes.
But you cannot monitor the appetite.
Yes, exactly.
Some cats, they tend to graze. They go back and forth to their food bowl. They don't get to consume what they need for at least half a day. They just go back and forth. So it works for those kinds of cats, but it's very hard to determine the appetite, which is, like we've mentioned earlier, one of the important signs that we have to look for if they're not feeling okay. For wet cat food or wet dog food, it easily becomes stale and... Oh, I think this one also needs some dental.
Oh God, we're going to have to take all our cats and dogs for dental cleaning.
For his age of 2 years. Do you give him the Dentasticks? Honestly, I think it doesn't work. That's a problem.
Aha, well, there's a sponsor we're never gonna get. It's okay, we don't have sponsors.
Because I've had a lot of clients and they would give that one and they still have problem with dental deposits. And he's very young, ha? He's just 2 years old. Bad breath, wala pa naman.
But so sociable and friendly.
Yes. Just like Drogo.
We don't speak their language. So how can we tell if they're in pain? Because, cats are not going to start moaning and groaning in pain. So
yes, they're not gonna moan because from the evolution, from the wild, they tend to hide their vulnerability.
As in, if you would just give me a sign, like sing to me the soundtrack of Lion King, I would know. But I don't. So how can I tell?
So they tend to hide it. So we need to look for cues. Like what you mentioned, one is appetite. Or changes in their behavior, like suddenly they tend to sleep more often. For urinary tract infection or anything related to the bladder, they have an abnormal way, suddenly tend to stay too long in the litter box, would vocalize, would cry out, or a cat that's usually seen hanging out, perching by the window, watching outside, would suddenly be not doing that. Suddenly, you don't see that behavior very often, then there might be something wrong with the cat.
And of course, I'm one of those who would actually inspect what their poop looks like. It's like the last emperor of China. Somebody was always looking at his.
Well, that's actually a good for a human.
It's like, it's a little too runny today.
Yes. And I would appreciate that for clients, because sometimes it's those little cues that would help me at least diagnose or come up with a plan for the treatment of their pets.
What do we do if we think our feline and canine housemates are depressed? Can we take them to a psychotherapist? What?
Well, here in the Philippines, I think it's not yet a specific field of practice in veterinary medicine. But I know for a fact in the US, there are those who would get into alternative medicine like homeopathy for behavioral problems with their pets. Maybe
if they seem sad, although sometimes we interpret the expressions on their face like my cat looks sad. Well, it's just his face,
Yes, yes. Give them proper stimulation. For young pets, toys to play with. For puppies, taking them out on walks would stimulate them and would tend to make them tired. Objects.
I used to attempt to buy toys for my cats. But I realized that it was all a waste of money because they would just ignore the toy and go for the box. Cats love boxes. So my advice to people is, instead of buying your cats expensive birthday and Christmas presents, give them a wrapped box. They'll love that.
And it works for Drogo and
as in, if they see a box, they'll try to get in it. I don't understand. You really should do an advice show for humans who live with dogs and cats, because just while we were taking a break, so many questions came up. Like, if cats and dogs are creatures of habit, does this mean that you have to consult them if you're renovating your house?
Not really consult, but more of consider. Consider. Like I mentioned earlier, if your cat has this habit of sitting
he likes to sit at the windowsill.
Okay. If you have to renovate, how does the cat get there? If it's jumping from the floor up to the windowsill, then that would be fine. But if the cat usually would take, let's say in this case, if this is the window, if the cat would have to go through the sofa first, jump on the sofa, and then jump on the windowsill, if you renovate, just make sure there's an alternative for the sofa.
There's a route.
Yes. Try to be considerate of your pets, especially for cats, that he can still do what he's used to doing even after the renovation. I remember of one client that I have. She has a cat of, I think 4 years. Then she became pregnant and suddenly she had to rearrange her room to accommodate the crib and all the baby stuff. And she would notice problems with her cat. Started not eating, using the litter box not as regular as before. And then it actually took several consultations before finally she mentioned to me that she rearranged her room. And that somehow affected
was what
the
was
behavior.
bothering
Exactly.
the cat.
And then when I advise her, can you just consider your pet's need? It's okay that you rearrange, but somehow make sure she can still do her normal routine. And that's when the cat started feeling better.
It's in the same way that you can't just bring home a new cat or dog, right?
Yes.
As in, you have to slowly introduce them to the existing family. So, for instance, if I have dogs and then I'm getting a third dog, how do I bring in the dog and assure that they will not be fighting the whole day?
Okay, I think you start them slowly. Just make the...
Do you have to keep them in a separate room?
For a few days. Just to make sure that the old residents become familiar with the scent of the new pet. When you want them to interact, just make sure you're there to supervise. So just do it slowly. And for cats, sometimes they're just not used to having another cat at home. So
they're territorial,
But with dogs, they're usually very social animals. So there's a big chance that they'll jive as a pack. But with cats, it's more tricky. Some wouldn't welcome them.
Although that, you know how there are cartoons where cats and dogs are always fighting, but a lot of cats and dogs actually get along.
Yes. And even pit bulls, sometimes they get along with cats.
Suppose you wish to adopt a stray. Although in the case of Drogon, he adopted me by running into my house.
Yes.
But suppose you want to adopt a stray cat or a stray dog. What should you do?
There's a saying, adopt, don't shop. There are shelters. You have Caro shelter and then the Paw shelter.
Yeah.
Where the animals for adoption were rescued by these organizations, have been spayed, neutered, vaccinated, and more or less the organization has an idea of the behavior of the animal that you're gonna adopt. Now, if you really wanna rescue or ended up rescuing, say, umuulan, and then you saw this kitten,
Yeah.
naawa ka, and you wanna pick up the kitten and
Adopted
decided to adopt
in a
it.
box, you know. So.
Yes. I would suggest, before seeing a vet, just allow 1 week of adapting to the new home. One of the first things you do after feeding the rescued, go to a vet and have at least a full checkup. Probably the vaccination, deworming.
Yeah,
At least
you'd have to have them dewormed.
deworming. Yes.
Well, a flea bath.
And then vaccination for cats. There's the 4-in-1.
And then I strongly recommend spaying and neutering.
Eventually, yes.
How old do animals have to be spayed and neutered?
For a time when I was in animal welfare, it's an issue of how young can you go. I've seen kittens, 1 month old, being spayed and neutered.
That
I
seems
find
a
it
little
too
young. Yeah.
In fact, when I found out about this trend, when I had the chance to go to the US for internship, I asked some of the vets who are doing the spay and neutering, and they would say they would do it to a 2-month-old kitten or a 3-month-old puppy, which I find too young, honestly. So I would ask this vet, if it's your pet, if this is your pet, for your pet, how old would you want them spayed and neutered? And they would say the 6-month rule. So how come we're doing it too young on our shelter animals? So for me, I think
there's
6
an
or more.
ethnic cleansing element to it, kumbaga.
Yes. Because I think the explanation for that, shelters, they don't want to adopt out kittens that are not spayed neutered.
Yes.
So they might as well do it as soon as they can. So when they get adopted out, it's no longer an
And give the
issue.
kitten a chance to find a home. Yes.
When I was at the shelter, when I was working for a shelter, I made sure they sign an agreement that they would come back when the cat that they adopted is, once it reaches 6 months, and they would come out for spay and neutering. So I guess there are ways to work around that. So 6 months. But when people ask me when is the best time to have it spayed or neutered, I usually ask them, what's the breed of your pet? So it's a case-to-case basis.
Animal welfare groups like CARA, Compassion and Responsibility for Animals, they constantly have to convince the general public that stray cats and dogs are not pests to be rounded up and put down, because that usually happens. There are a lot of aspins and puspins in the neighborhood. If somebody complains that they might bite their children or something, they're rounded up and taken to the pound, where 90% of the time they are put down.
Yes.
So how do you convince the general public that stray cats and dogs are not pests?
Okay. First and foremost, stray dogs and cats, they're from pet owners who just throw, and that becomes the source of these stray cats. There's been a big shift in the mindset of people. This is one thing I noticed. Well, after I graduated from school, they were considered pests. And there was no trap, neuter, vaccinate, return program, no cat communities. For now, we have the cats of Ortigas, cats of Araneta.
The cats of BGC.
Yes, the cats of Bel Air.
Cats of Bel Air, yes.
And it's a very good way of educating people that they're not pests. Let them be, because they are well maintained, they're fed, they're spayed, neutered. One thing with these cat colonies, they protect the area from rodents and from other cats coming into the community.
Yes, because they're territorial.
Yes. So that keeps them, and once they're spayed, neutered, you just let them live the rest of their life, live out the remaining years of their life.
Yeah.
One thing I noticed, everyone become aware after the cats of the BGC, Shangri-La.
Yes.
People became aware that they've been vaccinated, they're well taken
and there are
care of.
volunteers who take care of them.
Exactly.
Yes. So you feel that attitudes are changing, which is gratifying to know. Yes.
Close to where I live, there's a community of cats. There's a cat community, and they're feeders. Suddenly, I noticed that people are starting to pet these cats.
Bring them food, yes.
Bring them food, and it's a very good, at least the awareness.
Yes.
It's very good that they're they're more defenders for these feral cats, for these stray cats.
You mentioned trap, neuter, and vaccinate programs. These are the programs where stray cats and dogs are caught and then spayed or neutered vaccinated and then returned to the community.
Yes.
Yes, because even if you adopt 20 animals apiece, there will not be enough people to provide homes for all the stray cats and dogs. So TNVR is actually a good solution to the proliferation of strays. Yes.
And some stray cats, they just don't need to be adopted because
they want to be free.
Yes, they might not thrive in a home setting.
Yeah, for instance, in my building, there's always been a colony of cats. You know, but it's under control. You know, 4 at most. But one of the cats downstairs, I feed them every day. She's Jacob's sister, actually. She's a champion mouser. As in, every day she brings me a rat. It's sometimes this big, and then usually just a small mice. But I don't think she would like to live indoors where there is nothing to hunt. Yes.
When I was at POS, when we'd rescue kittens, after a while, we tend to see their adult behavior, so to speak. Some just don't thrive in group housing. So what we did was just to let them go feral. That's when we started observing them gaining weight. And eventually, some of them became friendly. After they were let loose, they became feral. And I think you cannot force the idea of an indoor cat to feral cats. They already have their own personality. So the TNVR is a very good alternative. If some became too friendly, just way too friendly, and you want to adopt them, then it's fine. But for some, they just don't thrive indoors. They don't like being kept inside the house.
We hear a lot about therapy animals. Is that going to be a thing in the Philippines where people travel with their cats, dogs, ferrets, hamsters? If they have a note from their therapist that says, these are emotional support animals.
We've long realized that the benefits from having pets, or at least petting a dog or a cat. Recently, I read one article about they would match a shelter dog with a prisoner for the behavioral rehabilitation of the shelter dog, as well as for the enrichment of the prisoners. Here in the Philippines, there's the animal-assisted therapy. So they would bring pets to orphanages or hospice center. Studies have shown they help with the coping mechanism of humans. I just recently met one pet owner. She came from the US. She was based there for several, I think, years. And she brought her cat, which was what she told me was her emotional support cat. Soon there'll be a lot of Filipinos, I think, who would be having pets for emotional support.
So, last question. Since my sanity maintenance program is, living with my 2 cats, and you love cats and dogs, but they've become your job, and so I'm sure you also associate them with stress. So how do you manage to stay sane when there are all these cats and dogs to take care of?
Okay.
How do you get rid of stress? Or since you do a lot of work with animal welfare, I'm sure there are, as we speak, 50 more animals have joined the waiting line at your clinic. Yeah.
Yes. When I was working in a shelter and I would see 30 patients, 30 dogs and cats per day, that's for consultation alone. And surgeries would be around 7 to 10 surgeries per day.
Okay.
It's
like, is this the tonsils or the spaying? Yeah.
Before I go home, I don't keep pets at home. I have no pets here in Manila. Because I think it's kind of unfair since I spend most of my day at work. After the long day, I would just sit outside of the clinic and there would be some feral cats, some outdoor cats would come close to me, or sometimes I would go inside the cattery and just pet one cat. And it has a different effect on me. I know why I'm tired the whole day was because of helping them.
Yes.
So I think that's how I kept myself sane when I was at the shelter, was just to keep in mind that although it was a very tiring job, it's helping them out. And that's what I set for myself to do when I had that experience with my own pet when I was young. So more of what I do with them. It's not their presence, but what I do with them and
That's a lovely thought. Thank you for taking care of all these cats and dogs, and I really think you should do an advice show.
Oh.
So thanks very much, and
Sure,
I guess
sure.
I have to make an appointment for Drogon and
Yes,